Welcome, Dan Williams, Survive Outdoors. Before we get started, I wanted to tell you what we do here. We do wilderness medicine videos. We talk about infectious disease, zoonotic illnesses, ticks, Lyme disease, Powassan virus. We teach you how to prevent injury and illness. We also do some gear reviews. If you like that kind of stuff, subscribe. Today, the most common injury, orthopedic injury that is, when you're hiking and backpacking. And we call it, in the medical field, a foosh, F-O-O-S-H, falling on an outstretched hand. So these little guys and your wrist, they get injured very frequently. Rocks, ground, hiking, jogging, running, trail running, you name it. You're gonna fall, you're gonna put an outstretched hand to catch yourself, and boom, you either dislocate at a joint or you can fracture a finger. So we're gonna talk about specifically how do you splint that, and when do you and should you put something back into place on your own out in the field with no medical knowledge. So let's get at that right now. Some basic, very basic anatomy. So we're going to draw the three bones of the finger here, and they have these little condyles on them, here, 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 here. And those are there for a reason. So what happens is tendons insert on these areas. The tendons on the top of our hand make our fingers go up, and the tendons on the bottom, or flexor tendons, make our fingers go down. If you dislocate at a joint, obviously you're going to see that because it's going to be angulated. And if you break it, you're going to most likely break it mid-shaft of one of these bones. Now, you can rupture a tendon, and the tendon pulls off of the bone, and if we x-rayed it, you wouldn't even see a fracture. Or that tendon actually pulls a piece of the bone off of the finger, and we would see that on x-ray. Both are treated differently, somewhat. The splint is very similar. But we're going to talk today about just an acute injury. You're out there, you're 3 or 4 days of getting back to urgent care, ER, your primary care doc. What are you going to do, and how are you going to splint this on either one? So clearly, if you fall, your partner falls, and your finger is angulated, and it's not at a joint area, very reasonably assume you have broken that finger. And if it's in the joint area, then clearly it's a dislocation with or without a fracture involved with that dislocation. So what do you do with this when you're, it depends on when you get back. If you're 4 or 5 hours from getting back, you can splint it in that position and come on in, and then we'll x-ray it and take care of it. If you're 24 or 48 hours or longer from getting back in, you're going to reduce that in the field. Very simple. It takes literally less than 4 seconds to do it. You just grab the finger, and some do slow, some say fast. What I do is I grab the finger that's angulated. I tell them, look, hang in there. I try to distract a little bit. I always count to the count of 3. 1, 2, 3. I'm watching their face, and boom, and I straighten it, and I got it back in position. And it is literally that quick. It sounds dramatic, and it's not. It's very simple to do. And you're going to put that in position. If you don't, and this is angulated, it could be pressing on a nerve, you could be pressing on an artery, it could actually lacerate one of the arteries that run on either side, and that could be ugly, especially if you fall again, which I've seen happen walking back to get help. So how are we going to splint this? So these you can get at pretty well any pharmacy, and this is part of a SAM splint. So you have these 3 fingers here. You have your 3 fingers. You have these 3 parts of your finger. This is the distal phalanx, the middle, and the proximal. And then you take your splint and you wrap Medi-Rip and you splint it. Now, is that correct? You would think so, right? No, this is wrong. 100% wrong. It's too short. So this needs to be splinted all the way down, because this joint is called the MCP, and you have to get this joint stabilized. If you don't, and you splint it like this, you can still move your whole finger and you're still moving the area of injury. So when you splint your finger, any of these fingers, you're going to want to splint it all the way down. Now in this picture you're going to see right here, this gentleman basically fell, and you look at their little finger, and right in that middle bone, it is angulated quite a bit. It's pretty blatant, and that's fractured. That's a transverse fracture. It's very unstable. So they're going to have to put a pin in that. And very hard to, I mean, it's easy to get back into place, but it will fall out of place very easily. And then you'll see the following x-ray where I reduced it, and you'll see on one view that it looks pretty good, and the other view you'll see that gap at the fractured area of that finger. And you look at the soft tissue on the x-ray and compare that to the other fingers, look how swollen that little finger is. Pretty swollen. So what you're going to do to make this splint, remember our SAM splint material, you can use this. You're going to take your, well, you don't have to take these, you can take a knife, for God's sake. This is aluminum and it's padded, it's very easy to cut through. But I love my Leatherman Raptors. They fold up. We've talked about those before, so don't leave home without them if you have them. SAM splint. You're going to cut you out a piece of this SAM splint. You can also use bark, but the point is that you want to make this long enough to come down and immobilize this joint. That's what you need, so you're not going to be moving the finger. So as you see, I like taking the end and just bending that like that so it doesn't slide. And I always try to keep it at a little bit, we call this position of function. It's just a little bit in a flexion position, so it's not straight. Just a little bit like that. That is comfortable for the patient, and you see it comes all the way down. Now there are some situations we'll talk about later when we talk about wrist fractures that you're going to splint all the way down, you're going to splint the whole hand. And then Medi-Rip. It can be called Coban, Medi-Rip. Kids call it the neat stuff. So you take that, you throw it on there. Hard to do with one hand. But what's nice about it is that it clings to itself, and there's like 50-mile-an-hour winds here right now. It's crazy. So you're going to run that down. Now you have the splint. So you'll see on here that the splint runs all the way down, and it's immobilized this joint also. So there's going to be times that you're down the road, we're going to talk about wrist fractures, and we're going to run that splint pretty well the whole hand, and we're going to immobilize the wrist. But with this, that finger's not moving. Have them keep it elevated if they can when you're walking back to your vehicle. Ice, just go to your next oak tree, you'll find some ice there. And they do have those nice little packets though that you can break, you can carry them in your backpack. It's extra weight, not a necessity. I never bring them, but that's something if someone's kind of really OCD, bring it, what the heck. So that is the finger splint method that we recommend you do for one of the most common injuries of just falling on that outstretched hand. All right guys, that is it. Finger splitting, reducing a dislocated or fractured finger in the outdoors. Keep your eyes on the horizon, your face to the wind. Stay safe.